Hey everyone, and welcome to This Explainer. I'm Dr. Evidentia, and today we're going on a bit of a medical detective journey together. We're going to uncover the hidden truths behind blood pressure measurement. Now, if you love empowering yourself with reliable, evidence-based health guides, well, make sure to hit that subscribe button right now so you never miss an update. So here's a startling question to kick things off. Are you actually measuring your blood pressure wrong? You might be making critical, completely unseen mistakes right in your own living room, or surprisingly, even sitting on the exam table at your doctor's office. Today, we're setting up a clinical detective arc to uncover exactly what it takes to find your true, accurate blood pressure numbers.
Oh, and before we dive in, here's our standard Dr. Evidentia medical disclaimer. This explainer is strictly for educational purposes, built right on established guidelines from the American Heart Association and recent cardiovascular research. It's really meant to empower your informed health decisions, absolutely not to replace the personalized medical advice of your own physician.
All right, here is our clinical syllabus for today. 1. The blood pressure basics. 2. Tools of the trade. 3. Perfecting your measurement technique. 4. Hidden blood pressure phenotypes. 5. Measuring beyond the clinic. And we'll wrap up with 6. The Evidentia summary. Let's get right into it.
Section 1. The blood pressure basics. Understanding the silent threat.
Get this, a staggering 46% of U.S. adults have hypertension, according to the American College of Cardiology and American Heart Association guidelines. I mean, think about that. That is nearly half of the entire adult population. This makes high blood pressure a leading modifiable risk factor for things like cardiovascular disease, kidney disease, and even cognitive decline. It's a silent threat, which is exactly why capturing the exact correct numbers is so absolutely critical.
But, what are we actually measuring here? Your blood pressure reading is made up of two numbers. Systolic, that's the top number, which represents the pressure in your arteries during a heartbeat. Diastolic is the bottom number, representing the pressure between heartbeats while your heart is basically resting. And medical evidence clearly shows that both higher systolic and higher diastolic pressures are independently associated with an increased risk for cardiovascular events.
Section 2. Tools of the trade. From stethoscopes to algorithms.
Historically, we've relied on the auscultatory method. This is your traditional approach where a doctor inflates a manual cuff and listens with a stethoscope for specific sounds. They're called Korsakoff sounds, as the blood flow returns. However, today, we're largely shifting to the oscillometric method. These are those automated electronic devices that detect the amplitude of blood pressure oscillations on the arterial wall, and then they use proprietary algorithms to estimate your blood pressure. The clinical consensus right now is that these automated office devices actually help reduce the human error associated with someone manually trying to listen for sounds.
Section 3. Perfecting your measurement technique, eliminating error.
So, looking at the research, it points out one of the absolute biggest pitfalls: cuff size. The evidence shows that an improperly sized cuff is just a massive source of error. The inflatable bladder inside the cuff needs to encircle 80 to 100% of your upper arm circumference. If you use a cuff that's too small, it's going to artificially overestimate your blood pressure. And if you use one that's too large, it underestimates it. It's kind of like a Goldilocks situation. Getting the right fit is literally a non-negotiable step.
Beyond the cuff, your body mechanics matter immensely. You have to follow these standardized preparation steps. Empty your bladder, sit with your back completely supported in a chair, uncross your legs, rest quietly for 5 minutes, and keep your cuffed arms supported on a desk at heart level. To put this in perspective for you, evidence shows that failing to do something as simple as supporting your back can artificially add 5 to 15 points to your systolic reading. I mean, that's huge.
What's really wild about these common mistakes is just how often they happen in everyday practice. Talking during the reading, having a full bladder, crossing your legs, letting your arm dangle on your lap, or, having a coffee right before your appointment, these all skew your true numbers higher. Be honest, have you ever accidentally chatted with your nurse or doctor while the cuff was squeezing your arm? If you have, go ahead and hit that like button and let me know in the comments.
Section 4. Hidden blood pressure phenotypes, unmasking the truth.
Okay, we're looking at two contradictory yet very real conditions here. First up is white coat hypertension. This is when the sheer stress of being in a clinical setting spikes your blood pressure, but when you go home, your numbers are perfectly normal. Interestingly enough, studies show women actually experience this white coat effect more often than men.
On the flip side, we have masked hypertension, where your numbers look absolutely great at the doctor's office, but they're actually dangerously high when you're just going about your daily life at home.
Masked hypertension is an incredibly hidden danger. Current estimates suggest that a shocking 17 million U.S. adults have masked hypertension. Literally 17 million people walking out of their doctor's offices with a clean bill of health, completely unaware that they're living with undetected high blood pressure for the rest of the day.
Section 5. Measuring beyond the clinic, finding your true numbers.
So how do we fix this? Well, there are two primary established methods. The gold standard is ABPM, or ambulatory blood pressure monitoring. You wear a programmed device for 24 hours as you just go about your life, and importantly, while you sleep. This is what helps identify dangerous nocturnal hypertension. The second method is HBPM, or home blood pressure monitoring. This empowers you to do daily self-management by taking rested, seated measurements over several days. Both of these are incredibly valuable for confirming a diagnosis outside those clinic walls.
Now, as an evidence-based science communicator, I definitely have to address the new tech on the block. We're seeing this massive explosion of emerging wearable technologies, smartwatches, smart rings, and cuffless devices, all claiming to track blood pressure continuously. While this consumer tech is super exciting, we really have to separate it from established clinical tools. These wearables are not yet validated for clinical diagnosis. They lack independent validation standards, so right now you just cannot rely on them to manage hypertension.
Section 6. The Evidentia Summary. Taking control of your health.
So the crucial point is this. Accuracy is entirely in your hands if you follow the rules. First, only use validated devices. You can check independent websites like Stride BP to verify if your home monitor is actually scientifically accurate. Second, ensure proper cuff sizing. Remember that 80 to 100% rule for the bladder length. Third, always follow the strict 5-minute seated rest protocol. And finally, track your out-of-clinic numbers to uncover any of those hidden phenotypes we talked about.
At the end of the day, Dr. Evidentia's mission is all about empowering your health decisions through reliable, balanced medical evidence. Thank you so much for joining me for this explainer today. If you found this structured breakdown helpful, please subscribe to the channel so we can continue learning how to take charge of our health together.
I want to leave you with one final, provocative thought. Next time you sit down and feel that cuff tighten on your arm, ask yourself, do you really know your true blood pressure numbers, or are they hiding behind a mask? Take charge of your health tracking today, demand the right cuff size, sit back in that chair and unmask the truth. Stay healthy, and I'll see you in the next explainer.